Hello guys, this is Philip Olo. Welcome to my YouTube channel. Today we are discussing on understanding of autism. What is autism spectrum disorder? Autism is a neurodevelopmental disorder characterized by triad of impairments in communication, social understanding, and flexibility of thought and behavior. Let's look at this triad of impairments. We'll start by communication, impairments in communication. What are the characteristics that when you see in a child, under communication, the child has a problem? Lack of or delay in speech development. You might find your child is not talking at all, or we call it non-verbal. That is one of the symptoms of autism. Difficulty in using and understanding speech, that is receptive and expressive language, the manner in which the child is receiving information and responding to the information. The processing is delayed. Then we talk of problem in nonverbal communication. Your child might be not talking at all, but humoring words. That is a problem. They have problem in qualitative and quantitative impairment in communication. This is whereby the child quantify the words you want to give out. In case your child start verbaling words, for example, if you tell the child to say 24, the child will leave the 20 and goes to the last word, which is 4, and the child will quantify the word 4. Then they have stereotyped communication. Stereotyped communication is whereby they repeat the sounds, or we call it echolalia, where they are so much repetitive. You'd call the child, for example, John. The child will repeat John. Then we go to another impairment under social understanding. They behave as if the other people do not exist. They are in their own world. They don't care whether you are there or not there. They have little or no eye contact at all. Then they sometimes don't respond when spoken to. You speak to your child and they just focus on whatever they are doing. They don't respond to your talk or whatever. Their faces empty of expressions except when they are extreme joy, anger, or distress. There's no way you read their facial expression unless they are facing some circumstances, maybe joy, extreme joy, happiness, distress, or anger. You'll see the child is communicating. Then they have little or no response in cuddling. Then if something is wanted, this child will hold an adult's hand or pull you towards the object that is needed, or towards the something that it needs or requires. They have difficulties in playing with others. They will rarely play with others. They are usually independent. Then they seem to be in their own world. This is where you find your child sitting somewhere alone and facing somewhere, looking as if there's something attractive in that direction. They look to be in their own world. Under this social understanding, we group them into 3 groups. The first group we say is passive group. This passive group is the least common group. Under this least common passive group, the children accept social approaches. This is whereby you call your child while you are smiling, the child will smile back. Social approach. Then they meet the gaze of others. This is where the child meets your gaze. When you go to this child while you are angry, the child will read your face and say, oh, mommy or daddy or my friend is angry. No, this is how I can approach this the person. They become involved as a passive part of a game. When you involve your child in a game to improve his social skill or a social skills, they are passively participating in that game. Then the second group is active but odd group. Active but odd group. The children under this group have active approaches to others but make strange contact. They have active approaches but make strange ways or strange contact with others. For example, they pay no attention to other people. So you talk to them, they don't care. You call them, when they are facing east, they are facing east. When they are facing west, they are facing west. They don't pay attention to you. They portray poor eye contact, although sometimes they may stare too long. When maybe they are doing something else. For example, if your child is playing with a toy or holding a pen, the child will stare at a pen for more than minutes, for too long. That is under group called active but odd group. Then they may hug or shake hands family. They may hold your hand when you are greeting or shake your hand family. Then the last group under this social understanding is over formal or silted group. Over formal or silted group. Under this category, it is seen in later life. It is common in most able people with autism. What do they do, or what are the characteristics of this silted group? Excessively polite and formal. That is where one day I asked a parent, do your child concentrate or pay attention to the child? Yes. If you give him a phone or you live in the house, you can sleep there for 24 hours until you come back. That is what we say, excessive, polite, and formal. There's something wrong with that child. They have good level of language. If your child happen to be talking at that early stage, the child can speak very fluently, very formal, and good language. But this you must think, some people will say, oh, my child has just developed a very formal language, good language, can speak well. Check at the characteristics and what has triggered this language. Then they try very hard to stick to the rules. In case you introduce your child to a play, the first rule you will give, for example, if it is a football game, then you tell the child, the moment you get into the field, kick the ball. Whatever the child will be doing is kicking the ball throughout, because that was the rule they were introduced to. Then let's look at the third impairment. We call it flexibility of thought and behavior. What is this flexibility of thought and behavior, or what are the characteristics that when we see in a child, we know the child lacks behavior flexibility? Number one, inability to play appropriately or engage in imaginative play activities. This child won't play with the others or won't play imaginatively. If it is arranging toys, it will be arranging toys. If it is arranging them up or down, that will stick to that. Very rigid in behavior. Then hypersensitive. There is hypersensitivity comes in whereby the child will smell everything you give. If it is food, the child has to smell. If it is what, you have to taste before eating. Then if it is an object, the child will feel the texture on the hand. Under this behavior, we will find the child is rocking or flapping. Find the child is fidgeting with the hand, just fidgeting. Then you ask yourself, what is going on? That is a way by which this child is motivating himself or giving himself morale. When maybe bored and feel like I don't want to talk to someone, they will rock their head. Then they lack imaginative play. This lack of imaginative play may lead to lack of understanding of other people's emotions. Rarely will they find it difficult to express their emotions in terms of happiness or hunger to others. Else they will just decide to keep quiet. Then many people many children with autism find their pleasure in special interest. They find their pleasure in special interest, meaning if they are to do a certain activity, it is particular that activity, nothing else. That is where their interest lies. Then they focus on part of or pieces. For example, you might find you give your child, let me give a variety of things, a variety of toys. Then the child will focus on one toy and pick only that toys alone. Then we have sameness and routine. They stick to the routine. Whatever you introduce them, my child, I want you to go to bed and wake up at exactly 2. The child will wake up at exactly 2. Then you start complaining, oh, my child is not sleeping. That is a characteristic. There's something problem. Repetitive stereotype activities. That is also under flexibility of behavior of thought and less. So let's look at repetitive stereotype. Under repetitive stereotype, this is where the taste is coming in, the 5 senses. The child will smell anything you give, taste, feel, tap different surfaces to see the texture. Then the child will listen to mechanical noises. That is whereby you take the child to a noisy place, the child will block the ears. The noise is giving a lot of pain, coming in a very high pitch. Then if it is in house, the child will keep on switching off on and off lights in the house. Then this child will spine objects, for example, or twiddling. If the child has a pen or an object, the child is twiddling an object or spining an object severally until you prompt him, hey, what are you doing? Then he will realize. Then banging the head is also getting here as a repetitive or stereotype activity. Then they sometimes have a complex sequence of body movement. They walk like they're in a ladies' show. You find, this my boy is walking like a girl. Then you people are enjoying. There's a characteristic or sometimes symptoms of an autism that this child is portraying and you don't know. Then we talk of extensive bedtime. Some oversleep, and others at the midnight they are awake. So you will take your child to the doctor. Oh, my child is not sleeping. My child can oversleep. That is a symptom of autism. If you look at the family, sometimes sitting when there's a mealtime at the family, when you want to eat mealtime, the child sits at a particular place and a particular chair. If you change the place and chair, the child is very rigid and will start crying or throw tantrums or do something else. Then they are attached to strange objects. We find when you are walking, the child speaks tins of polish, tins of bottle tops on the way when they are walking. That one you ask yourself, why is this my boy doing this? And they are prone to routine. If you introduce him to timetable, that is what the child will follow. Then those are a few the characteristics that we can identify in a child with autism. Let's look at the causes of autism. Up to now, it is difficult to point a finger on one thing as the cause of autism. But observers and experts associate autism with the combination of genetics, developmental and environmental factors. Let's look at genetic factors. Genetic factors is under theory of inheritance. This is whereby it is believed that a parent from families with autistic members is likely to give birth to children with autism. That is genetic theory. Then let's go to food allergies. This is evidence. This is evidence that allergies to certain foods could contribute to autistic symptoms. We have looked at two factors. Genetic factors, theory of inheritance, food allergies. Then let's go to number 3, leaky gut syndrome. Leaky gut syndrome is the inability of the intestinal wall to keep out large and unwanted molecules. What is causing this? This is caused by increased of sensitivity or allergies. Why? This sensitivity or allergies are combination or can be caused due to excessive or continuous use of oral antibiotics, growth of yeast, overgrowth of yeast, then heavy chemicals like mercury, leads, etc. Then intestinal infections can also cause them, among others. There's another thing we call conditions such as gluten and casein intolerance. All these are due to leaky gut. So this protein and the wheat products that people believe cause the autism, they don't cause, but they trigger the characteristics of autism. Then let's look at the diagnosis. Do we actually have medical diagnosis for autism? My answer is no. Up to now, there is currently no medical diagnosis for autism. But what do professionals do? They use the observable characteristics and checklists to screen and diagnose autism. Thank you, my viewers. I love you so much. Please remember to subscribe. If you have not subscribed, subscribe and like my YouTube. Welcome.